Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Twin Gestation. Introduction. If you are pregnant with more than one baby, you are not alone. The number of twin pregnancies and other multiple births has been rising. There are certain factors that increase a woman's chance of giving birth to twins. There is also a greater chance that something could go wrong with a twin pregnancy. However, attending prenatal visits can help you deliver two healthy babies. This program will help you understand twin gestation. It discusses how twins develop during pregnancy, prenatal care, and possible complications. Reproductive system. In order to understand pregnancy, it is important to know about the female reproductive organs. They are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. When an ovary releases an egg, the egg goes down the fallopian tube to the uterus. It may become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The cervix is the lower, narrower part of the uterus. It is a passageway that connects the uterus to the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. During pregnancy, the cervix is tightly closed to help keep the baby inside the uterus. During childbirth, the cervix opens to allow the baby to pass through the vagina. Pregnancy. During pregnancy, the baby is in a special fluid called amniotic fluid. The baby and amniotic fluid are in a bag called the amniotic sac inside the uterus. The baby gets nutrition from the placenta. The placenta is an organ between the amniotic sac and the uterus. It grows with the baby during pregnancy. The mother's blood delivers oxygen and nutrients to the baby's blood through the placenta. The mother's blood also removes waste from the baby's blood through the placenta. The baby's blood travels to the placenta through the umbilical cord. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Twin gestation. The period of time that a baby spends developing in the womb is known as gestation. If you are having twins, then both babies are developing at the same time in the uterus. Twins can either be fraternal twins or identical twins. Most twins are fraternal twins. Fraternal twins develop when two separate eggs are fertilized by two separate sperm. Each twin has his or her own placenta and amniotic sac. Fraternal twins are no more alike than they are to other siblings from different pregnancies. They do not share the exact same genes. If you are having fraternal twins, you may have two boys or two girls. You may also have one boy and one girl. Identical twins are less common than fraternal twins. Identical twins develop when a single egg is fertilized by a single sperm and then splits into two. Identical twins may share a placenta. However, each identical twin has their own amniotic sac. Unlike fraternal twins, identical twins share the exact same genes. This is because they come from the same egg and sperm. Identical twins look almost exactly alike. Also, unlike fraternal twins, identical twins must be of the same sex. This means that you may have two boys or you may have two girls. However, you cannot have one boy and one girl. Risk factors. There are several factors that increase a woman's chance of having twins. These are known as risk factors. Heredity is one risk factor for a twin pregnancy. If a woman has a family history of multiple births, she has a greater chance of having a multiple pregnancy. Another risk factor for a twin pregnancy is race. African and African American women are more likely to have a multiple pregnancy. The number of previous pregnancies can also increase the chances of having twins. If a woman has had more than one previous pregnancy, she has a greater chance. This is especially true if a previous pregnancy was a multiple pregnancy. Age also affects a woman's chance of having twins. Pregnant women who are older are more likely to have multiples. Another risk factor for a twin pregnancy is infertility treatment. Fertility drugs can cause the ovaries to release more than one egg at a time. Other treatments may place multiple embryos in the womb. These treatments greatly increase the chances of multiple babies. Tests. Often, a woman knows if she is expecting twins before delivery. Routine exams during prenatal checkups can show if you are going to have twins. Sometimes your healthcare provider may suspect you are having more than one baby. Your uterus may grow faster or be larger than normal at a certain stage of pregnancy. To confirm, your healthcare provider may use an ultrasound. An ultrasound uses sound waves to create pictures of the uterus. If you are having twins, sometimes an ultrasound can tell if your twins are fraternal or identical. Prenatal care. A healthcare provider can give you information about prenatal care. Prenatal care is the care a woman gets during pregnancy. Prenatal care can help keep you and your babies healthy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. Don't miss any. They are all important. If you are pregnant with twins, you will need to see your healthcare provider frequently. This is because carrying more than one baby at a time puts you at risk for certain complications. Healthcare providers can spot health problems early when they see the mother regularly. This allows healthcare providers the opportunity to treat any problems early. Early treatment can cure many problems and prevent others. Healthcare providers also talk to pregnant women about steps they can take to give their unborn babies a healthy start to life. Your healthcare provider can also tell you how much weight you should gain if you are having twins, as well as if you need extra vitamins. He or she will also be able to tell you how much activity is safe. Babies of mothers who don't get prenatal care are 3 times more likely to have a low birth weight. These babies are also 5 times more likely to die than those born to mothers who do get care. Possible complications. There is a greater chance of complications with a twin pregnancy than a regular pregnancy. The following section looks at some of the possible complications of a twin pregnancy. Women carrying more than one baby have a higher risk of premature birth. Premature birth is a birth that happens before the 37th week of pregnancy. These babies face many possible health problems. Babies born at or after 23 weeks of pregnancy have a reasonable chance of surviving. However, babies are more likely to be healthy if they are born closer to 37 weeks. Low birth weight is another possible complication of a twin pregnancy. A baby has a low birth weight if he or she weighs less than 5 pounds 8 ounces. Another possible complication of a twin pregnancy is high blood pressure and problems with the kidneys in the mother. This is known as preeclampsia. Preeclampsia can also limit the oxygen and nutrients the babies need to survive. Sometimes a pregnant mother develops a problem that causes her blood sugar to get out of control. This is known as gestational diabetes. It can be dangerous to the mother and her babies if left untreated. Sometimes, during a pregnancy, one twin develops more than the other twin. This is known as discordant twins. Often, the smaller twin will face problems during and after birth. If a healthcare provider believes that a pregnant woman will have difficulty with natural childbirth, he or she may recommend a surgical operation to deliver the babies through an incision in the abdomen. This is known as a C-section or cesarean. It is more likely in women who are pregnant with twins or multiples. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. If you are pregnant with more than one baby, you are far from alone. The number of twin pregnancies has been rising. Gestation is the period of time a baby spends developing in the womb. If you are having twins, then both babies are developing at the same time in the uterus. Twins can either be fraternal twins or identical twins. The difference is in how your babies are conceived. There are certain factors that increase a woman's chance of a twin pregnancy. For example, infertility treatments greatly increase the chance of having a multiple pregnancy. Often, a woman knows if she is expecting twins before delivery. Routine exams during prenatal checkups can show if you are going to have twins. There is a greater chance of complications with a twin pregnancy than a regular pregnancy. However, keeping prenatal visits can help you deliver 2 healthy babies. Thank you for using Explain.